Welcome back to New Method Live. So excited that you're here. And today we're talking about IV infusions. For those of you who already have it, this talk will give you a little bit more information about why it's so awesome. And for those of you who've never had it, this will be a way for you to be able to finally decide if you're ready to jump in, because there's a lot of conflicting informations out there, right? Some people will say, oh my goodness, don't even bother getting this stuff. It's just a waste. You're just going to expel it out of your body. And some people will absolutely swear by it and say that it's amazing. So today we'll help you make the decision of whether or not IV infusions are for you. And by the way, big hint, spoiler alert, they're for you. So let's talk about IVs. And let's start with, why do they work? Okay, what is an IV? IV stands for, let's just get it out of the way because some people don't know, it stands for intravenous. Intra means in, venous means vein, so in the vein, right? So IV infusion gets in the vein, and that's what IV stands for. When I used to work in the hospital, when I worked in the ER, obviously we used IVs all the time. So I think I spent most of my day in the ER just putting in IVs. Why? Why do we use IVs in the ER? Well, first answer is because it gets the job done fast. If you come in dehydrated, I'm not going to hand you a glass of water and say, drink up, my friend, you'll be fine. That's not going to work out. I'm going to put an IV in your arm and get you hydrated, and your vital signs will stabilize and you get rehydrated really fast. If you're in a lot of pain, if you broke a leg, am I going to hand you oral medication in a cup? I mean, if I do, you probably wouldn't like me too much as back then. So what we did was put an IV in your arm and put pain medication right into your bloodstream. Why? Because it works faster. Same is true now in my office. If someone comes in with an infection, some infections, you can have oral antibiotics, go home, in a few days it will take care of itself and be fine. But some infections are really serious. Those patients, I'm sending right to the ER to get IV antibiotics because it works faster. So speed is a big factor in why IVs work so well. It goes right into the bloodstream. And the reason it works so well is because it bypasses the GI system, right? If I swallow something, my stomach has to process it, and my entire GI system has to process it. And then it's going to take time before it hits the bloodstream. So the IV bypasses the GI system and gets right into your bloodstream. So that's the first reason, speed. But the second reason IVs work is because you can give higher doses. So higher doses, why do we care about that? Well, again, let's go back to the infection example. When you take an oral antibiotics, put it in your mouth, only some of it actually gets to the infection. But if you have an intense infection and I give you a high dose antibiotic that goes right into the bloodstream, you'll do better. So the same holds true for supplements. Sometimes more is more. Let's take a moment and talk about vitamin C. It's very popular. We use vitamin C. Oh, I have a cold. Let me get vitamin C. Let me get high C, energy C, whatever's out there. Let's talk about that. When we take something orally and it goes into our blood, another way of saying blood is serum, only a certain amount ends up in the blood. And that's called concentration, serum concentration. How much of a vitamin, let's just say vitamin C, stays in my blood is serum concentration. So no matter how much oral vitamin C I take, my serum concentration, your serum concentration, will not go higher than 9.3 milligrams per deciliter. Now, I'm not going to say milligrams per deciliter every time because that's an annoying word to say. I'm just going to say 9.3. So if you take vitamin C, the highest serum concentration you'll have is 9.3. Okay. If I take it IV, the highest I'll get is 80. 9.3 versus 80. Now, why do we care? Why do we care that we get more? Well, vitamin C becomes antiviral at 10 to 15. So you're taking it orally and getting up to 9.3, but it becomes antiviral at 10 to 15. It becomes anti-allergy at over 80. And I'm sure some of you have heard that vitamin C is being studied for certain cancers. And in those studies, they are only looking at IV vitamin C, not oral doses, because they know that the oral doses won't cut it. So they're doing cancer research on IV vitamin C because it's about getting a higher dosage. Same is true for magnesium. IV magnesium, well, oral magnesium, when you take it orally, doesn't really raise your serum concentration much. But IV magnesium raises it double and triple. So again, who cares? Well, a lot of people care because it's used for migraines, asthma attacks, fatigue, fibromyalgia, depression, seasonal allergies. It's used with heart patients. IV magnesium has the capability of going straight into your mitochondria, and the mitochondria is a part of the cell. It's called the powerhouse of the cell, but let's just say it's a really important part of the cell, and getting to it quickly is pretty important. So once again, we're in this crossroads. I talked about this once in my adrenal fatigue between the medical world and the holistic world, right? So in the medical world, yeah, IV magnesium works great when my patient is sick. It works great if you have asthma. It works great if you have a migraine. But if you're going to take it just to feel better, well, then that's just nonsense, right? If you're going to take it to treat an illness, it's magical. And we have like all this studies around it and we use it in the ER. But if you're going to take it because you want to feel better or enhance your performance or prevent disease, well, then it's just nonsense, right? And I find that always entertaining. And I want you to pay attention to that. If it's used to treat illness, we can extrapolate that it's going to be great for wellness. Now, I'm not a conspiracy theorist at all, and you know I practice medicine all the time. But one of the reasons there's not enough studies about supplements, IV supplements and supplements in general, is because most of our studies in our country are done by pharmaceutical companies. And I'm not against pharmaceutical companies. They've created amazing, life-saving medications, and I'm happy that they exist. But it does limit the amount of research that can be done on natural remedies. So we have to extrapolate some of these conclusions. Again, if it works great on illness, it works great at migraines, it works great on asthma, why wouldn't it work for wellness? And that's what I want you to think about. IV infusion, bottom line, why does it work? It goes right into your bloodstream. We have speed, and you can get mega doses that you can't get orally, which can help with illness, improve wellness, and prevent disease. Now, before we continue, I always say, and I'm going to say this every live, do not diagnose yourself, okay? If you're not feeling well, do not just make an appointment at the IV lounge and think that's it. You need to see your MD or your NP or your PA, and you know I love all three of you because MDs are my friends, I'm an NP, and my wife's a PA, so there's love for all of you. So make sure you go to a provider and get fully checked out, get diagnosed. Do not self-diagnose and do not use IV therapy instead of treatment. Okay, I want to say that as clearly as possible. So having said that, let's talk about how to incorporate IVs into your life. This is an important question. I get this question a lot. For our ER patients, time is of the essence. You come in, you have to get the IV right away. If you don't get the IV in right away, your blood pressure won't be normalized, you won't get hydrated, your infection won't go down. So time is of the essence in the ER. In the outpatient, it's not emergent. And the way I like to use it is what I call part of this complete breakfast. Let me tell you what I mean by that. So if you're going to go out and smoke and drink and eat McDonald's and pizza and chicken nuggets, God bless you, but the IVs probably won't help you. You're welcome to use them, but they won't move the needle on your health too much. Why? Because you're putting in toxins all day long, and then you're getting one bag of supplements. The balance, as you can see, it's not going to work out for you. You're welcome to use it, but it probably won't make a big difference for you. So the way I like to use it is in conjunction with a healthy lifestyle, part of this complete breakfast. So the patient is eating clean, doing the work, moving, and getting exercise in, and now they want to take the health to the next level. So we give our patients oral supplements, depending on what's going on with them. But then we also want to add the IV supplementation to really kickstart it and get them going. So we like to do it as part of an overall lifestyle, and that's the best way, making sure the body takes what it needs. And the beautiful thing about it is whatever it doesn't need, it will expel. And another question I get asked is how often? Excellent question for those of you who asked it. Well, the answer is it depends. And I'm going to say this a lot, but it depends. This is not a one-size-fits-all. We try to stay away from one-size-fits-all. It depends on the patient, and it depends on the type of IV. So let's talk about that. Some of our patients just need IVs for a few weeks or a few months. In the meantime, they're cleaning up, they're moving, they're taking supplements, they're starting to feel better. They're doing a lot of things in their life that's going to make sure that they keep taking their nutrients in. They're getting it from their new diet, they're getting it from their oral supplements, and then we slowly can phase them off of the IV infusions, and they could just live with their nutrients, with their great diet, and their oral supplements. And then if there's some sort of crisis or some sort of setback, we can always come and up it again. So some patients use it that way. And some patients really don't do well without it. We notice right away that as soon as we pull back the IVs, they start to deteriorate. And we don't know who those people are until we start, unfortunately. For some people, it's just genetic. Without this constant washing of their cells with the nutrients, they just don't get the results that they need. And for some people, either their illness is just so advanced that as soon as we pull them off, they don't do well. And so we just keep it up. So it depends on the patient, and it depends what's going on. Now, there are some IVs, which I'm going to talk about in a moment, that really are specific and have a specific protocol. But except for those, it really depends. Another question I get asked is, what goes into the IV? Like, what is in this? It looks like water. Well, I guess sometimes it could be water. Let's talk about what's in there. So there's always a base. It could be sterile water. It could be normal saline. It could be dextrose. So that's your base. And then we put things inside of it depending on what we need. So we could put calcium in there, magnesium, all kinds of vitamin Bs, amino acids, and all kinds of deliciousness go into our IV cocktails. You could always go on our website, thenewmethod.com. Remember, the new K is with a K. And there's a whole list of our IVs, and you can just check it out there. I do want to talk about a few things, though. There is something that we kind of put in almost all our IVs. It's called glutathione. And glutathione is magic. And I want you to Google it, and I want you to get to know glutathione because it's amazing. Our body produces glutathione naturally, and it is something that prevents inflammation and reverses cell damage. However, as we age or as we're sick, we produce less and less of it. So we need more and more of it. So we try to put that in our IVs because it's purely magical. So these three IVs here, NAD, Plaquex, and alpha-lipoic, let's talk about those for a minute. Okay, NAD is a coenzyme. Enzymes are things that make processes happen in your body. So it is naturally found in your body. And again, it's one of those things that as we age or as we are ill, we make less and less of exactly at the time that we need more and more of it. So it functions at the mitochondria of our cells, at the really important part of our cells. And as I said, it declines as we age or if we're ill. And it supports healing, enhances performance, brain fog, chronic issues, but it's also used for people who have addiction cravings or withdrawal symptoms. So for the people who are using it for withdrawal or addiction, the recommendation is once a day for 10 days straight. But for people who are using it for enhancement or brain fog, it depends on you. You can use it once before an event. You can use it as part of your once a week regimen. It really doesn't have a protocol. One thing about NAD though, it is not a comfortable IV to get. What do I mean by that? All our other IVs that you'll see on our website, you come in, relax, you have your blanket, you watch a screen, you're on your phone. Some people take a nap. It's delicious. NAD is not like that. NAD is uncomfortable to get. Some people feel hot. Some people feel anxious. The process of getting it is uncomfortable. This is not the IV you want to start on. So if you're one of my newbies and you wrote it down, or if you know it, do not sign yourself up for an NAD. NAD is when you're kind of more comfortable and you know where you're going with it. NAD is not your starter IV. I wouldn't want that to be your first experience because you'll never come back. For those of you who are ready for it, it is well worth it. My next and favorite IV is Plaquex. It was initially discovered to remove fatty plaques from the arteries. There's amazing scans that are done before Plaquex and after Plaquex, and we could see just the fatty deposits gone from the arteries. So it's amazing. For those people who are using it for that, the recommendation is 2 times a week for 10 weeks. But it's also been discovered to help psoriasis, skin in general, inflammation, the liver, the gut. And for those, there are no specific protocols. You can use it as part of your complete breakfast. I try to get it once a week, and I love it. I swear by it. Alpha lipoic acid, ALA, is another one of those things that is essential for cell metabolism and mitochondria. These are all mitochondria. They're great for the mitochondria, these three specialties, which I love. And they help energy production. ALA is one of those things that can pass easily into the brain. So it really helps with brain fog, really helps protect the brain nerve tissue. It's amazing. In other countries, it's used for diabetic neuropathy. It is part of the protocol for diabetics who have neuropathy. That means pain. Some people who are diabetics will have pain, nerve pain. So in other countries, it's actually used for those patients, and then it's given daily for 3 weeks. So if you're using it for diabetic neuropathy, that would be the protocol. But otherwise, you can use it again as part of this complete breakfast, depending on what you're trying to manage. So this is where we are so far. And in case you didn't figure it out yet, IVs work. They work because they're faster. They work because they're higher doses. They work because they can get right to the mitochondria. They wash your cell with the nutrients that they need. Your body takes and absorbs what it needs as you're making the other changes. And of course, whatever your body doesn't need, it will excrete out. So you can't OD on this stuff. The things that go into your IV infusions, you really can't OD on. So you're good with that. And of course, this can get confusing. You may not know which way to go. So we're here for you because at the end of the day, we want you to become the game changer in your life because I'm going to make you say it with me every week. You always knew there was a better way.